aids and appliances and the daily living component. Number 14. Figure 1 shows the proportion of normal rules cases awarded the daily living component of PIP. Who scored all of their points through aids and appliances. Normal rules cases are all those not made under the special rules for terminally ill people. As the chart shows, this proportion has more than tripled from 11% in April 2014 to 35% in September 2015. This increase has largely been driven by a significant and sustained rise in relation to activities 1, 4, 5 and 6, preparing food, washing and bathing, dressing and undressing, and managing incontinence and toileting. Around 3/4 of those who score all their points through aids and appliances score the minimum number of daily living points needed to qualify for the standard rate of the daily living component. Figure 1. Proportion of those awarded the daily living component who scored all of their points due to aids and appliances, PIP new claims and reassessments, normal rules only. Source: PIP Computer System Records. The graph shows the proportion of daily living awards where all daily living points were given as a result of descriptor B. On activities 1 to 8. The data used includes PIP Normal Rules Awards made between April 2014 and September 2015, including new claims and reassessments. Number 15. In addition, judicial decisions have broadened the scope of what is considered to be an aid or appliance. For example, recent judgments have found that a bed or chair could be considered an aid or appliance if an individual is unable to dress standing up. As could a smoke alarm, if a person with a hearing impairment used it to help them to cook a meal safely. This means that the definition of aids and appliances includes articles that are unlikely to be a reliable indicator of extra costs, as they are widely available and commonly used, irrespective of the level of need. Number 16. This is consistent with the findings of the first independent review of the PIP assessment, undertaken by Paul Gray, which recommended that the department review how aids and appliances are taken into account in PIP assessments against the original policy intent and make any necessary adjustments to guidance and training. www.gov.uk/government/personal-independence-payment-PIP-assessments-first-independent-review. This was based on evidence presented to the review, which suggested that in some instances, points were being awarded because claimants chose to use aids and appliances rather than needed them. And noted that in many cases, these were non-specialised items of very low cost. Number 17. In a sample of 105 cases reviewed by DWP, where claimants scored the majority, or all, of their daily living points due to aids and appliances, only a small proportion, 7%, were considered likely to have moderate needs and additional costs. In the remaining proportion of cases, over 90%, they were likely to have low or minimal extra costs. Where claimants did require low-cost aids and appliances, there would be a one-off purchase cost, but little ongoing additional costs relating to daily living only. Additional costs relating to mobility were not looked at, as they are assessed separately. In 19 of the cases reviewed, claimants had no clearly identifiable ongoing extra costs relating to daily living at all. Illustrative examples of the cases reviewed are provided. Illustrative example 1. 61-year-old man with chronic obstructive pulmonary disease. He cannot stand for long due to fatigue and breathlessness. He can help his wife prepare food, providing he sits down. He sits on a seat in the shower and holds the sink for support when using the toilet. He also sits to get dressed, which takes a long time due to breathlessness, and wears easy-to-pull-on clothes. Low daily living extra costs reflect one-off costs for aids, such as a perching stool. He already has a shower seat and grab rail, as his wife needs them. And other aids are unlikely to be of much benefit. Illustrative example 2. 58-year-old woman with generalized osteoarthritis, which causes her pain in the knees, shoulder, ankles, hands, and lower back. She has difficulty standing for long to prepare food due to back pain. She can access her shower independently, but finds it difficult bending to wash the lower half of her body. She uses the sink for support when getting off the toilet and dresses sitting down and wears slip-on shoes for ease. Minimal daily living costs reflect one-off costs for a perching stool and some long-handled aids. Number 18. In addition, in many of these cases, it is likely that the aids and appliances for which points were awarded were non-specialist, low-cost items that are widely available. For example, electric tin openers and lightweight pans. Others, such as perching stools and grab rails, are often routinely available free of charge by the National Health Service, NHS, and Adult Social Care. Furthermore, in some cases, whilst claimants benefited from the use of the aid or appliance, they did not need it. Number 19. As a result, in the cases reviewed where claimants scored all of their points due to aids and appliances, the cumulative point score appears to be a poor indicator of extra costs. This is inconsistent with focusing the benefit on those with greatest need, and awards being determined consistently. Number 20. We have therefore decided to consult on how we account for the use of aids and appliances when determining entitlement to PIP, to ensure that we deliver the original policy intent.